I've got a question for you this afternoon. How often do you sleep all the way through the night without any interruptions, staying asleep at least 7 or 8 hours? A new study finds that most of us do not sleep like that. The 70 million Americans that responded to the study say they have a sleep disorder, and that's not good for our health. So let's talk about sleep. With us this afternoon is Stuart, who is the CEO of InfoBionic.Ai. Thanks for coming in.
Thanks for having me.
I'll start with explaining what is it that you do at InfoBionic?
So we are a remote cardiac monitoring company that allows a physician to prescribe a device if you are having some symptoms that would mandate the device to be put on, and you wear it at your home, and it's able to detect if you have arrhythmias or other associated potential issues that would cause complications with your heart or otherwise within your body.
And some of those complications can come from not getting enough sleep. How many hours of sleep do I need? And what happens? How does it affect my heart?
Sure. I think the best data says between 7 and 8 hours per night is adequate amount of sleep. But what can happen is the lack of sleep, especially consistent lack of sleep, is a disruption to your circadian rhythm. And that disrupts your heart rate, it disrupts your blood pressure, which all of those things have longer term consequences if unchecked, or high blood pressure or hypertension, heart failure, and even stroke.
Now, does the lack of sufficient sleep cause, is it direct? Because a lot of people wake up, I hear my friends saying at a certain age, they get up, they have to use the bathroom at night. When do we know that we have a problem? And I need to go ask my doctor, how bad is this?
I think it would manifest itself in some sort of a symptom where you may not actually relate it to your sleep. And if you visit your doctor, telehealth, or in person, generally one of the first questions you get is, how are you sleeping? Because it's one of the first indicators that cause a lot of things. And I can tell you from personal story, if I don't sleep well because of travel or something like that and I get disrupted, I can almost tell the impact of the lack of sleep on my heart, because I've had some symptoms that have been derived from poor quality sleep relative to my heart. So
wow.
It's definitely very real.
So you know what the trigger is. I have a picture of one of your monitoring devices. So take a look and tell me how this works.
So the device there itself has some cables that come out of the bottom, and those attached to your chest, just like you would get an ECG at your doctor's office. You would wear that around the house, or on, when you're running errands, basically as you go about your normal day activities. Meanwhile, that device is collecting your heart signals and it's streaming it to the cloud. And one of the benefits of kind of modern day cardiac monitoring is it's continuous monitoring, because a lot of times the symptoms are not continuous and you have them only for a brief period, sometimes 30 seconds or less. So having something that's continuous versus intermittently checking it gives you a greater ability to capture the symptom and then give that to the physician so that they can make some sort of intervention, whether that's put you on medication, tell you to sleep more, or invasively.
Okay. Now, I know there's a lot of people watching who say, I probably need to have this. Do you go in and you tell the doctor, or how do I get from I think I have a problem to wearing the device?
Yeah, there's kind of a stepwise function. There are some screening devices you can purchase, like the Apple Watch and other devices, to be able to look at your heart rate at home. That's one way to do it, and you could send that to your physician, even electronically. They allow you to do that. But you would be a phone call or any kind of interaction with a clinician to tell them what your symptoms are, and they would bring you to their office and assess you, and then after that they would make the determination whether you would need the device or not.
But we need good stuff. Like it said, millions of Americans, lots of folks not getting that sleep they need. Thanks so much for being with us from InfoBionic.
Thank you very much. Appreciate it.